Welcome to the Smart Legacy Podcast, your resource for protecting assets and securing your future. Hosted by Stockton and Cant, join us as we cover essential estate planning and elder law topics, such as wills, trusts, and Medicaid planning. Stockton and Cant, your trusted attorney advisors in safeguarding what matters most. Welcome to another episode of the Smart Legacy Podcast. I'm your host, Glenn Stockton, managing attorney of the law firm of Stockton and Cant, with offices located in Overland Park, Kansas, as well as down south in Gardner. Today's episode is going to be a really practical one. We're talking about Medicare, and more specifically, how to make smart Medicare decisions that protect your health, your finances, and your overall retirement plan. Now, I want to say this right up front. Medicare is one of those topics that a lot of people assume they understand until they actually have to make decisions. And then suddenly it can feel overwhelming. The choices, the timing, the cost, the fine print, and the what if I do the wrong thing fear. So today I've invited someone that I trust to help break it down. Bobby Chien with Medicare KC. He's an independent broker here in Kansas City. I've known Bobby for about 20 years, and when my own family needed help navigating Medicare, Bobby is the person I called. He helped my parents, he helped my wife's parents, and I don't know anyone who knows more about the ins and outs of Medicare than Bobby. So I'm grateful to have him here in studio with us today to help bring clarity to our listeners. So Bobby, welcome, and thank you for joining us.
Thanks, Glenn.
So as we get started here, maybe just give us a quick introduction and about who you are and your business and what you guys do.
Okay, well, my business, like you said, is Medicare KC. I started it with me and my wife. So my wife has actually joined the business for about 5 years now. She was in the healthcare profession beforehand, but we're independent brokers, and our goal is to try to help people navigate the minefield of Medicare and which decision to take.
So roughly, and you correct me if I speak wrong, but the way I talk to people about this, I look, Medicare is our insurance we get when we turn age 65. We go in. And there's a lot of options we go in. So maybe help us break this down. Medicare, I mean, you got Part A, Part B, Part D. So kind of take us through what is Medicare and what's all the difference between this Part A, B, C, D. How does that work?
Okay. I will try to summarize it as best I can so it doesn't take up too much time. But Medicare, first of all, one of the biggest misnomers is everybody thinks Medicare is for free. Well, Medicare Part A is free if you have worked enough quarters within the United States and paid into it. Part A covers your hospitalization. But once again, it's not all entirely free. If you go into the hospital, there is a deductible that you have to pay for your first 60 days of being in the hospital. Then after that 60 days, then there's a copay every day after that. So Part A covers hospitalization. Part B is your doctor coverage, and that will cover about, Medicare alone covers 80% of the costs. The last 20% is on you. All right. Okay. Then Part C, those are what is called Medicare Advantage plans, which are the best way I describe Medicare Advantage plans, Part C plans, is they're group health care for people on Medicare. So you have a private insurance company, whether it be Humana, Aetna, or United Healthcare, any insurance company, you're getting their version of Medicare. They, by law, have to cover everything that original Medicare covers, but you may have a doctor network, a hospital network, co-pays, deductibles, things like that, that original Medicare doesn't have.
All right. And then Part D?
Part D is prescription drug coverage. So.
All right. And then people have a base premium, if you will, for that they pay, but then based on income, those premium costs can go up.
Correct.
And is that true for the Part C as well as,
So Part C, because that's tied in with your Medicare. You have to have Medicare Parts A and B in order to get a Part C plan. So the increases are actually government charges, not the Medicare Part C charges.
All right. So let's go on the kind of plain English summary here of an explanation. Someone's turned age 65. What decisions are they going to have to make, and what happens if they fail to make them?
Okay, we'll start with if they fail to make them. First off, there's lifetime penalties. If you don't sign up for Part B in time, you have a lifetime penalty, 10%. So if you don't sign up for a prescription drug plan, you have a lifetime penalty that is basically 1% per month for every month that you don't have prescription drug coverage. So if you go an entire year, that's a 12% penalty.
And you'll pay that for the rest of your life.
For the rest. So, and that's just based on 12% of whatever the cost of that plan is. And that's lifetime. When you go 10 years without it, you're going to pay 120% more than somebody that's had a drug plan since they turned 65.
Right. So let's assume they do. They say, okay, well, we're gonna sign up. Do they have to wait until they turn 65? Can they sign up sooner than that?
You can sign up to 3 months before you turn 65.
Right. And so to sign up, how do they do that? Do they?
You go through Social Security Administration and only go to call the ssa.gov. Make sure you're on the government website, or you call the Social Security office or go into the Social Security office. Anything other than the .gov is an insurance company trying to sell you something.
Right. So if somebody wanted to go on, are you able to help them navigate them and help them do it? Or are they still going to have to go into Social Security to do that?
I typically don't get involved in helping them sign up. I point them in the right direction and tell them what they need to do, but I try not to, because a lot of that privacy issues, I don't want to get into that and disturb their privacy.
One of the things, and like I said, I've known Bobby for 20 plus years, and I don't know anybody who knows more about this stuff than he does. So when my family runs into these issues, I just refer them to Bobby because I know he's going to steer them in the right direction, and he's going to shoot straight with them if I get out. Okay, so someone turns 65, they go in, they've got some decisions to make, and then they're going to figure out, do they want the Part C or not, right? Because that's not required that you have these other plans involved.
Well, you've got two ways that, and actually three. Okay, you can have Medicare alone, which I don't suggest. Okay, the reason I don't suggest having Medicare alone is because there's no cap on it. If you have to pay 20% of a $2 million doctor bill, that's not going to be fun. So you either have to have Medicare plus a Medicare supplement or a Medicare Advantage plan, the Part C. It's one or the other. You can't have both.
Right. And I'm assuming there's a lot of options and different companies, as you said, that they can go for. So you help navigate them and walk them through which is the best coverage for them.
All I do is I try to educate people on their options. It's up to them which way they would like to go.
All right, this is a question that I get somewhat frequently from clients. I have a client that's turning 65 this year, but they're covered under their spouse's health plan. And they want to know, well, can I just stay on my spouse's plan that's being provided through the employer, or do I have to go onto Medicaid?
No, Medicare, not Medicaid.
I'm sorry, Medicare. Yeah. Thank you for correcting me there.
You do not have to go on Medicare. You may, as a spouse, you may want to, because with group health insurance, typically the employee, the rate is pretty inexpensive. but the spouse is more expensive. So as a spouse, sometimes it's beneficial monetarily wise to go on a Medicare and a Medicare supplement or advantage plan, one or the other, financially. Okay. But do they have to? No, they can stay on the plan for as long as their spouse has group coverage.
Would they be then subject to the penalties for not signing up? They would not be.
They just have to get a letter from the HR department showing that they had group health care coverage.
Okay. And so that then is true if they're still working at age 65 and they're covered under their employer plan, then they would not have to go on to Medicare.
Same thing.
Is there certain plans agree? So let's say they have a high deductible HSA plan is what their coverage is, and they're 65 now. That's still a qualifying plan. They don't have to switch over to go to Medicare. They can stay on that plan.
Correct. But once again, it may not, depending on how much they're charging, my son works for UPS. He pays like $6 a paycheck for his insurance versus a small company that it may be $900 or $1,000 a month. So, you just have to look at the financials of it.
Does the size of the employer matter? So you talk about the premiums, it matters, but is there anything else? Because I think I've heard something about, the coverage has to be credible. What does that mean, and does that matter?
So anything, as long as it's a, Affordable Care Act qualified plan, I guess is the thing. A group health care plan is going to the Christian health share plans aren't really health insurance, not going to be qualified. Short-term health insurance that you can buy outside of the market that isn't really group coverage won't qualify. It has to follow some of the Affordable Care Act things in order to be considered qualifying is the easiest explanation I can give for you.
All right. Here's another question I get from clients who are concerned. They're enrolled in what I believe they say are the Medicare Advantage plans, right? So they've got networks, as I understand it, with doctors. And I've had some find, for whatever reason, their doctor, their hospital is not a network or is no longer a network, no longer accepts that plan. Can that happen? And if it does happen, what are their options?
It happens all the time. Well, I should say all the time, but it's happened the last couple of years. Just here in Kansas City. Unfortunately, just because a doctor or hospital leaves the network of the insurance company doesn't give you the right to just drop that insurance company, move to another one, unless we're in one of the enrollment periods. The annual enrollment period, which starts October 15th and goes to December 7th. It actually starts October 1st, but you can't change anyone until October 15th. Or right now we're in the open enrollment period, which is from January 1st to March 31st. Those are the only two times that you can move easily. So there are some other special enrollment periods that can allow it, but they're not a guarantee. That these are the guaranteed times.
Is there penalties for moving when those enrollment periods come up? So at that point, they can switch.
Yeah. No penalties, no health questions.
And if they didn't have the Advantage plan and they were on Medicare, are there doctors, hospitals that can deny Medicare coverage, or are they required to accept Medicare?
Well, no. Doctors and hospitals have to accept Medicare as well. So if your doctor doesn't take Medicare assignment or the hospital decided not to take Medicare, unfortunately, you're not going to be able to go there either.
All right. So in that case, switch doctors or switch plans.
Yeah. I mean, we had just here in Kansas City this year, we had North Kansas City Hospital kick everybody out of network except for one insurance company. So it became either change your doctors or change your insurance.
And so is that what you advise them to do at that point? They reach out to you, say, here's what happened. Your advisor, they're going to change.
Yeah.
Okay. All right. Here's a question. How much should someone have saved up for medical expenses once they're on Medicare?
That's not an easy question to answer because everybody's different. Everybody's family health history is different and things like that. But some of the studies have shown that a couple from age 65 on are going to spend about $300,000 in their lifetime for medical expenses after they turn 65. So divided by 2, it's roughly 150 grand. So, but could that be more? Could that be less? It sort of depends on your health and what happens.
You know, one of the statistics that I've seen frequently says that we will spend more on health care during the last 2 years of our life than we spend the whole rest of our life put together. As we get older and, we can start falling apart a bit. You know, one of the things that we help clients do, because I tell them not all their dollars are created equal or treated equal. So if we do have to pay out of pocket for those expenses, often using the IRA money, that money that's never been taxed, or the IRAs, 401ks, because that expense can become a tax deductible expense, out of pocket medicals, as long as they're more than 7.5% of our adjusted gross income. So where we pay can matter, where you've got the money saved up as much as how much. So making sure we're not going to rely 100% just on insurance, the Medicare insurance. It insures the risk, but it doesn't completely prevent us from having out-of-pocket expenses. Fair to say?
Yes, sir.
All right. So let's talk about, we've talked about the Medicare Advantage plans, Medicare Supplement. What's the difference between those?
Well, a Medicare Supplement, so those are exactly what they sound. They supplement original Medicare. So you can have different plans with the same letter. So the most popular Medicare supplement plan right now is a Plan G. That will give you the best coverage. That's sort of like the Cadillac plan currently. So that is the most popular plan. But a Plan G with one insurance company is identical by federal law to another insurance company. They have to offer the same basic benefits and services for each Plan G. So they have to cover the exact same thing. The only difference in most cases is price. So one company, because they are bigger and they spend more on marketing, they may have to charge a higher premium than a smaller company that doesn't do a whole lot of marketing or just wants business. All it is price. What each insurance company thinks they need to make sure they make money. And then, so a Medicare supplement, they have a premium attached to it monthly. And so you pay the premium and then you get a prescription drug plan on top of that, and that's your coverage. Then if you move to the other side, the Medicare Advantage side, that's sort of what I've told you is the group health care for people on Medicare. That's where you have to have a network of doctors and hospitals. Sometimes you'll have a deductible, co-pays every time you go to a doctor, or you may have to get pre-authorization to do things. With the Medicare supplement, there's only 2 questions you'll ever have to ask. Do you take Medicare? Is this approved Medicare procedure? If they say yes to that with the Medicare supplement, you just go, no getting authorization or anything like that. With the Medicare Advantage, the doctor may have to say, hey, file this paperwork with the insurance company to get approval for it.
So, a lot of our clients are what I would refer to as snowbirds, right? They right after the holidays, they've gone to warmer weather,
I'm envious.
So for those people, because now, can they pick ones they've got their network in Kansas City, but they've also got it in, Arizona, Texas, Florida, wherever this warmer weather they're going to, or people that travel a lot. How does that impact them, and how do you guide them through to making the right decisions for them?
Okay. Well, so Medicare Supplement, we'll start with them. On the Plan G, since that's the most popular one, it has $50,000 worth of foreign travel that's outside the United States. So I'd suggest to almost anybody, whether you've got a supplement or an advantage plan, you go ahead and buy travel insurance if you're going outside the United States. It goes up as you age, but it's well worth it because $50,000 of medical is not very much. Some of the Medicare Advantage plans, so all the Medicare Advantage plans will give you worldwide emergency room coverage. So Snowbirds that go from here to Florida, even if they've got an HMO, they still have emergency coverage with the Medicare Advantage plan. Now, some of the companies will give you their nationwide networks, whether you're in Florida, whether you're in Nebraska, wherever, you can get a nationwide. Some of them just require you to give them a heads up that you're going to be in that area for an extended period of time.
Right. When you meet with somebody for the first time, what are 3 things, or what are you trying to learn about them to help them figure out what is the best options for them?
Well, that's a tough one, because all I do, Glenn, is try to educate people what their options are, what their choices are, and then ultimately they have to be the decision maker of which way is best for them, be it finances, comfort level, what their friends have. Ultimately, all I do is try to educate people of what the options are.
Next question would be this. What are the top mistakes you see people make when they're approaching Medicare decisions?
Top mistakes. I would say listening to their friends too much. And I know that sounds weird because you want to trust your friends, but sometimes what's best for your friends isn't best for you. If you've got health issues and things like that, well, you don't necessarily want a Medicare Advantage plan, because this could be your one time to get on a Medicare supplement if you've got those health issues. And then vice versa, if you don't have the health issues of your friends and you want to save the money, then a Medicare Advantage could be good for you. But once again, that's just laid out for what your comfort level and everything is going to be. So
if someone is looking, they're approaching age 65, is that the good time to reach out to you and your company to get advice on this?
Anytime you're on Medicare, as long as you're on Medicare, you're welcome to call me, and we'll talk about what you're on, what you like, what you don't like, what your concerns are. That's what we do. All we do is try to tell you what people's options are.
Well, and as I said at the kind of outset, you're the guy I trust with this, who I've sent my family to, because I know you understand this stuff, know it, and you're going to steer them in the right direction for them. What are some red flags that should cause someone to slow down and get advice from you or someone like you before they enroll or change plans or anything? What would be some of those red flags that might come up?
Red flags. I don't know if I hope I don't get in trouble for this, but my first red flag is don't call those TV advertisements that you see on TV that they're promised, whether it's Joe Namath, Jimmy Walker, is that the Dynamite, or William Shatner. Don't call the TV ads, because those people aren't local. They don't know the market, and you're never going to hear from those guys again. They're not in it for you. You could be in the best plan for you, but they don't care about that. They only care about making a sale and moving on to the next person. So no matter how good those TV advertisements look, I would say don't call, because A, once they get your phone number, then they never stop calling you. And then B, I would say that, get someone local that knows the market, knows which hospitals and doctors are in network, things like that. There's so many brokers here in Kansas City, and a lot of them are great. Not just me. I'd like to say it's just me, but I know there's a lot of great brokers out there that do the right thing for people and not for what's best for their wallet.
So you mentioned that anytime someone's on Medicare, that's a good person to reach out to you. How often should people review their Medicare coverage to say, hey, is this plan might have been the right plan when I was 65 and healthier? Is it the right plan now? So do you have a thought process on how often they should review their coverage and options that are available?
Well, I'd say do it every year, because there's changes every year, whether it's doctors, hospitals, whether it's finances, whether it's health, and here's the other thing we didn't touch on, and I'm going to backtrack a little, Glenn. You can always move to a Medicare Advantage plan. No health questions asked. To get a Medicare supplement, you have to be able to answer health questions. They can say no to you and deny you coverage. So that's why sometimes it's important to make that decision right off first, because if you're just aging in, they're guaranteed issued while you're aging in or coming off the group health. They have to take you. You could have stage 4 cancer and they have to take you. But after 1 year, basically, you're locked in. And if you have a health issue, Medicare supplements don't have to accept you.
That is an important thing, I think, for people to know at the outset. And again, why I always tell people, get professional advice, get educated, understand your options, because when we understand how things work and what our options are, we make better decisions. And it's not always about what's the cheapest premium now, because back to that statistic, we're going to pay more in healthcare expenses the older we get, making sure that we've covered ourselves at that point in time. One thing I want to say before it gets away here. So we have coming up very soon here on February 18th at 6 o'clock p.m. We're doing our first time we've done this together, what we call Medicare School. And you're going to be coming into our office. And I know a lot of those slots have already filled up. People to come in to be able to learn more about this and be able to ask questions. And so for the listeners, I would encourage you, get signed up for this and know that our plan is, because we've got limited availability for, seating for people in here, and it's already filling up quick. We're going to plan to do more of these in the future as a way for you to come in and get your questions answered. And as Bobby said, review this stuff on a regular basis, making sure annually you're kind of looking at this and making informed decisions. So if somebody wants to work with you, has questions for you, what's the best way to get a hold of you or to initiate that process?
The easiest way is call my cell phone. Everybody always has their cell phone with them almost 24 hours a day, right? So the easiest way is to call my cell phone. And do you want me to give that number?
Yeah, sure. Feel free.
My cell phone number is 913-406-7592. That's the easiest way to get a hold of us.
And we'll make sure we put that in the call notes so people easily be able to get that. And do you have a website that people can go to?
MedicareKC.net is my website. I will,
Okay. And when they go from like a time frame, if people are, starting this process, they can start at 3 months before age 65. Mm-hmm. And they have to be enrolled unless they're covered under some credible plan, group coverage plan, or something like that. How long do they have after turning 65 that they have to be enrolled without getting penalties?
They've actually got a seven month window without getting penalties if they don't have extra coverage. So you got the 3 months before to sign up, your birthday month, and then 3 months afterwards.
Okay. So start that process, get the information they need, reach out to you. Tell me a little bit of this, because one of the things we didn't talk about before we wrap up here, let's get this. So you and your wife, you're a husband-wife team on this.
Correct.
So she does the same things. You guys are working with people. And this is all you do, correct? I mean, you're not
Correct.
doing other things, which I think is important too. That this is that. All right. Well, guys, I hope you found today to be useful and relevant information. Bobby, thank you for coming in and joining with us. Anything you want to say, just kind of final wrap up before we
Just
get out
thank
here?
you for the opportunity, Glenn.
Okay. Well, I'm looking forward to trustee school, so I'd encourage everybody, get signed up for that. And if it fills up, we'll get you on the wait list for the next Medicare school that we're going to do. But this stuff's important, so I want to get this information out. So as always, hope you found it useful, relevant. Please like and subscribe. You'll find us on Spotify, YouTube, Apple Podcasts. With that, thank you for tuning in, and know that you can find this and other episodes on our law website at stocktonlaw.com as well. So thank you for tuning in.
The information provided in this podcast is for general informational purposes only and does not constitute legal advice. Listening to this podcast does not create an attorney-client relationship. Laws vary by state, and this podcast focuses on estate planning and elder law in Kansas and Missouri. If you are located in Kansas or Missouri and require legal advice, please contact our office. Otherwise, consult a qualified attorney licensed in your jurisdiction.